Delhi city is seeing a surge in cases of COVID-19, and this surge this time around is very different from the kind of surge that we had seen in the month of April. The surge is different this time around because there is not only an increase in hospitalizations, but also there is an increase in occupancy of oxygen beds and ventilator beds in Delhi right now. For example, on the 26th of April, when Delhi reported around 1,200 cases, the number of people hospitalized stood at 114. On the 8th of August, when Delhi reported almost the same number of cases, the hospitalizations stood at 419. In fact, the worrying bit here is that many people are not even reporting their symptoms and are not testing, so the actual figures of COVID-positive patients in Delhi could be much higher. A survey that has been done by local circles, for example, talks about how 80% of households in Delhi have either flu or COVID-19 symptoms. Over 11,000 residents of Delhi, Gurugram, Ghaziabad, Noida and Faridabad responded to the survey. In most cases, it appears that people are choosing methods like the antigen method to check if they have COVID or not, which means that the authorities are not notified and there is also a risk of them spreading the infection to other people in the household. Medical practitioners and hospitals are also reporting a growing number of viral or flu cases. In most of these cases, people have been complaining of a runny nose, headache, sore throat and fatigue. Listen in to what doctors have to say.
Though most of the patients who are coming to hospitals have come to hospital for some other illness and found to have COVID-19 illness. There is a subset of patients who are high risk, who are immunosuppressed, post-transplant, who want to be in hospital so that there is no complication, or if at all a complication comes, they can get help early. This increased spike is both because of because we have let our guards down and also a strain of our virus.
The survey done by local circles talks about how over 8 in 10 households of Delhi and NCR surveyed have had one or more family members impacted by viral flu-like symptoms in the last 30 days. Of these, 54% of households have reported 2 or 3 family members having or recovering from the flu in the last month, while another 23% households have had 4 or more family members affected. Is this another wave of COVID-19 infections? Well, experts say that cases might just surge given that there are several reinfections in India right now, and Delhi seems to be reporting many cases of reinfection. However, a surge like the third wave of the pandemic, where the Omicron, the fifth variant of concern, had led this massive surge is rather unlikely, is what many experts have been saying. Also, whether or not there is a sixth variant of concern, only time will tell. However, right now it does appear that it is Omicron and its subtypes leading to these surges. Experts, however, have warned that a new variant could be just lurking around the corner and that one must not be leaving anything to chance. In fact, almost 3 years into the pandemic, our best bet continues to be COVID-appropriate behavior.
For more informative videos like this, keep watching India Today News Mo.